Hey, it's Danny. Welcome back to Danny's Rig. First of all, I just want to apologize for being so long since I posted a video. I've been playing around with different software that I'm using for my videos going forward, and I finally came across something that works well, so I'm back now. Alright, so here's a little preview of what will go down in today's talk. So today we are going to be continuing our medication administration videos. And the medication that we will be looking at today is oral glucose. We will meet with today's patient and then we will review when to use and when to not use this drug, and this will help us determine if oral glucose is an appropriate drug for our patient today. So let's meet the patient. Today's patient is Jack. Jack is a 20-year-old male who is found to be not acting right in his college dorm room by his roommate. He is awake and breathing, but has a thready pulse. Your partner speaks to the roommate, who tells them he does not know about Jack's medical history, but he does know that Jack keeps some sort of medication in the mini fridge. Hi, Jack. I'm Danny. I'm one of the EMTs helping you today. What are you doing here? I'm fine. I'm just hungry. Jack, I'm going to ask you a few questions that may sound silly, but they're necessary. Go ahead. Any idea what I'm going to ask Jack? Here's a clue. The call came in as not acting right, and our patient appears lethargic. I am suspecting altered mental status. Altered mental status is a term used to describe these out-of-it patients who are not alert and oriented times 4. The questions I am about to ask Jack will test to see if he's alert and oriented. Hence, we will find out if he is in an altered mental status. Testing for altered mental status is one of the first parts of your patient assessment for all your patients that you will treat. How old are you, Jack? I'm 20. This first question tests to see if our patient is oriented to person. This is a good question to use because we know how old our patient is from dispatch, and we know from our patient's roommate. So we know that his answer is correct, and we're not guessing if this is accurate information or not. This is why you should avoid using the question who the president is. Not only does this avoid any political debate or any chance that your patient's from another country, but sometimes families have their own little pet names for the president, so we might think that what he's saying is wrong, but it's really right, and it just creates a false negative. And the reason that this question tests to see if he's oriented to person, because we're asking a question about himself, so he knows who he is if he knows how old he is. Where are you right now? Well, I remember going to bed, so, this is my house, right? We are inside your dorm room. This question tests if the patient is oriented to place, meaning it's testing if he knows where he is right now. Note, many patients who are not oriented to this may just ignore the question, since he's not oriented to this particular question. I've had some patients that just won't answer you and will kind of look at you kind of confused. But this patient in this example just gave the wrong answer. Also note that it's totally fine if you reorient the patient to what's going on. So this patient thought he was in his house, and I told him, you're in your dorm room. As long as you do it in a calm and straightforward way and you're not arguing with them or sounding annoyed, this is completely fine. Not to go off topic, but it's similar to if you have a patient who's hallucinating, meaning that they are seeing or hearing something that is not present. It's a good response to say to that patient, I understand you are seeing whatever it is that they're seeing, but I am not. Meaning that you're not denying that they're seeing that. You're not saying, no, you're wrong, but you're not going along with it and pretending you see it when you don't. Approximate day is it, Jack? I have no idea. This question tests for orientation to time because we're asking if he could tell what time of the day it is. This question is appropriate for our pre-hospital patient. However, if you're working in a hospital and you're asking a patient these questions, it might not be the best because if you're in a hospital for a long time, you might not see outside a window, you might not be outside, you might really just lose track of the time of day. And it doesn't mean that you're in an altered mental status. All right, Jack. Could you tell me what's going on right now? What's going on? I'm talking to the EMTs. Okay, so this patient is oriented to event, yet he appears confused. The patient also seems to be going in and out of understanding the event since he didn't understand why we were here previously, meaning that when I asked him what's going on and he thought about it, he was able to tell me he's talking to the EMTs, he knows who we are, but on his own, like a few minutes ago, maybe he would have been confused and not really know what's happening in his room. Okay, so our patient is considered A and O times 2. A meaning alert, O meaning oriented, and times 2 because he answered 2 of the questions correctly. And according to my state's protocol, we can take a blood glucose reading for any patient who is not alert and oriented, which would be this patient since he couldn't answer 2 of the questions. But again, follow your state's protocol because in some states, BLS providers cannot take a blood glucose reading. Jack, I'm going to take a blood glucose test. You will feel a pinch, okay? Okay. Just a reminder, always tell your patients what you're doing. Even if the patient is altered or completely unresponsive, there is evidence that the patient still benefits from hearing your voice. To take a blood glucose reading, set up your supplies. I like to open my test strip first and sit it right outside the meter, but not completely inside. This allows the meter that I use, the test strips time out very quickly, meaning that after a certain amount of time, it kind of expires, and you need a new test strip in order to use the meter. So I don't want to feel rushed while I'm getting everything ready. So I kind of leave it ready, but I don't actually put it in until it's time to use it. Next, you are going to use your alcohol prep pad to clean the patient's finger in an outward circle. This will move the dirt away from where you will be creating an opening into the patient's finger by pricking it to get the blood, so it minimizes infection by moving the dirt out. Using the lancet, which also often known as the pricky thing, to poke the patient's finger, you are going to prick perpendicular to the lines on their finger, so their fingerprints, when you see the lines, make the lancet go perpendicular to the line. You'll see in the picture in this video. This will allow the blood to exit the finger more easily, and you also want to be sure not to poke the very tip of the finger. You want to do the pad part of the finger because the tip, if you poke it, that could promote bruising. Okay, now you are going to hold their finger down and using your gloved finger to push downward the blood down to allow it to leave more easily because of gravity. It's a great thing. And then when the blood leaves, you will be using that to measure their blood glucose reading. So you can now, that test strip that we didn't put completely into the meter, you can put it all the way in now because we're ready to use it, so we don't have to worry about it timing out. And you're going to use that test strip to scoop the blood up to put it in the test strip, which is connected to the meter. Now, if you have seen a test strip, you'll know what I'm talking about. If not, once you are practicing in the field, you will know. But the test strips kind of have like 2 layers, and then between them there's like a little indent, which is where the blood is going to go. So it's not, the blood is not like on top of the test strip, it's like kind of inside of it. There's going to be a little indent where the blood is going to go. And if you see it's still timing out, just keep scooping. You probably just need more blood. Okay, so once you do all of that and you scoop the blood into the test strip, a number should appear immediately on the meter. And it's a good idea to practice whatever meters your agency uses because they might all be a little different. All right, Jack, your blood glucose level is 47, which is low. Note that there are many causes of altered mental status besides just hypoglycemia, which is low blood glucose. Therefore, if his blood glucose level was within normal limits, which is considered about 70 to 110, we would move on to considering other potential causes of his altered mental status and how to treat them. However, right now we have caught hypoglycemia, so that is what we're going to treat right now. And according to my local protocols, to treat hypoglycemia, which is defined by my state as less than 60, we can give oral glucose to reverse the hypoglycemia. So Jack does have hypoglycemia, so can we give him oral glucose to solve this issue? Let's review the indications and the contraindications of oral glucose to determine if he is a candidate for oral glucose treatment. So remember, indications are factors which tell us, yes, you can use this drug. We are indicating that you use this drug. If they meet these requirements, this drug will help them. So the indications are to treat hypoglycemia, which he does have hypoglycemia. He's less than 60. And in a diabetic patient. Okay, and then contraindications are unresponsive or unable to swallow. All right, well, we know that the patient is hypoglycemic since his blood glucose is 47. Do we know if the patient is diabetic? He hasn't told us that he is, and his roommate isn't sure. You could use your judgment on this one that he is. This is because, remember the roommate told us that he keeps medication in the mini fridge. So we are looking at his medication and we see inside the mini fridge that he is carrying insulin. And this is a strong indication that he is diabetic because insulin is really only used for diabetes. So follow your judgment, follow your local protocols, call medical control if you need to. But for the sake of the situation, we will say that our patient is in fact diabetic. And again, you could ask him, and he is altered, but see what he says. Okay, now looking at the contraindications. Is Jack unresponsive? No, he's not. His eyes open spontaneously when you walk in. He's talking to us, so he's not unresponsive. And is he able to swallow? We're going to say that he is, and that he does have a gag reflex, because he's not drooling everywhere. We could see that he's able to swallow everything down. Therefore, since our patient matches the indications and he doesn't match the contraindications, our patient is a candidate for oral glucose. Jack, we are going to give you this oral glucose tube to eat. You're going to take this tube and eat all of it, and hopefully you will start to feel better. All right. Okay, so our treatment is successful. Jack is starting to look much better, and he doesn't sound as confused as he did when we first met him. We're going to continue to transport him to the hospital and closely monitor his airway, his breathing, his circulation, his vital signs, and his glucose level. So I hope that this lesson on oral glucose administration was helpful. Thank you for watching and stay safe out there. Bye.